Okay, thank you for inviting me to be here. And I want to echo everybody's thoughts and well wishes for the service that you get when you buy an iTrace. Thank you very much. It's hard to follow the talks that you guys have heard before. I'm an ophthalmologist, been in practice 41 years, hard for me to believe. And we do have a Digby with Digby, iTrace. If you can have it to measure the cornea, we have it, or have had it. Okay. So I don't know if any of you have had this problem, but from time to time a multifocal or a toric lens comes back and they're just not happy. And I'm scratching my head trying to figure out what's going on. So this patient I saw, I don't know, maybe 6 months ago or so. He came in and he did not want to have to wear glasses for distance. He wasn't interested in a toric multifocal and decided we would do just a toric lens. I thought, oh, that makes pretty good sense. Although his vision, even with where it was 20/30, when you looked at the cataract, there really was pretty close nucleosclerosis and a lot of cortical changes. And I thought his symptoms made sense for the amount of photophobia that he had. We had a surgical plan using the lens X. In my notes, I write LRI if indicated because we do repeat testing after the day that I see them initially to see if our measurements coincide with the first ones, and I've got a great staff that helps me a lot. Final post-op visit. His vision is not as clear as I thought it would be. And I pull up the record and I'm like, he's playing with 2020. Plus a half, 2020, kind of not happy about the plus a half. But what was the problem? Was there any residual astigmatism? How about internal optics problems? So I looked at the instruments that I had and thought, yeah, that's an iTrace problem. So these are the reasons I like the iTrace. You do get a keratometry. You get an identification of the aberration, what the location is, and what the degree is. This is a real quick, down and dirty, easy measurement of dry eye. And then it helps you identify the steep axis of toric correction. Everybody that comes into the office that wants cataract surgery has an iTrace, also has an IOL master or lens star. We still do manual keratometry. We do some cams in there, and we also get our manual macular OCT, because I've been surprised at the ones that you miss visually that you find after surgery. So we don't like those surprises. We go in and get OCT ahead of time. As you know, you can't charge for it, but it saves you a lot of time. Keratometry. We have great staff. Keratometry in good hands is an excellent measurement, but you got to look hard for the good hands. And not everybody in this clinic has the same ability to get a good reading for you, or particularly with the axis failure. All right, iTrace benefits otherwise. We get shine analysis of the toric calculator to help you with the toric calculations. Very important is a toric check to see what's the placement where it's supposed to be. And then you have the measurement of alpha, angle alpha, which we talked about before. It's not a problem, has not been a problem for me very often, but when it's a problem, it's a problem. So we do measure that. I like the colors, I like the fact you look and in a half a second, you say, that's keratoconus. That's not going to be very good. Although I'd love the audience's opinion about, we've been using some toric lenses in keratoconus. If you have stable readings on the keratoconus, most cataract patients are a little older, and the patients have had a reduction in the keratoconus and they're pretty darn happy. Toric calculator, many of you may have used this. We use this and we look for consistency. So we may run a number of different tests doing our calculations, and we look for consistency. You look for the axis placement. Was it in the right place or not? In this particular case, it was spot on. There was no need to rotate it out. We look again, angle alpha, not really a factor in this particular case. And then the shine analysis shows for higher order aberrations, so that they're not there. You like to have that preoperatively, so you don't use it postoperatively. That's why we do this test and everybody preoperatively. So in this particular case, since there was no change with rotation, the residual astigmatism was not the issue. We looked at the dysfunctional lens index, and we saw, and it looks pretty dang good too. That's not the issue. We looked at the macula, it's perfectly normal, just like it was pre-operative. So what we know is, it's not the lens, it's not the residual astigmatism, it's not the macula. It's probably between his ears. We kind of keep looking for other issues. I'm happy to listen to suggestions, but I love the iTrace because it lets me do all that and bam, bam, just like that, and save the time and the place. Okay?